Welcome back, everyone, to the Deep Dive. You know we love to go deep on some fascinating topics, and today is no exception. We're going to be talking about how children use art to deal with the really tough stuff that can come along with being sick or injured.
That's right. It's called medical art therapy.
Medical art therapy.
Well,
And it's such an interesting area. It's amazing how kids can use art as this outlet to kind of work through and even, begin to heal from some of the stuff that they're dealing with when it comes to their physical health.
yeah, and I think it makes sense. For adults, we know talking about things can be therapeutic, but kids, especially really little kids, don't always have those verbal skills. So art becomes this visual language
Absolutely.
to communicate those more complex emotions or fears that they can't always put into words.
And our deep dive sources today really highlight three major things that cause stress for children when it comes to medical situations.
Okay, yeah, let's hear it.
So, number one, the biggie. Separation from parents or caregivers. It's huge, right?
Oh, absolutely.
Suddenly you're in this unfamiliar environment, the hospital.
Right.
You're away from the people you depend on for comfort and security.
Yeah, that's a big one for sure.
Big one, for sure.
Hmm.
Then you have loss of independence and control. So illness in and of itself kind of robs you of a little bit of that. But then you add in hospitalization. You have all these medical routines and procedures that are being dictated by others.
Right. You're not making the decisions anymore.
You have very little control over what's happening to your body.
Exactly.
And then finally, there are all those fears and anxieties. Fears and anxieties about pain, about the medical procedures themselves. And even this heartbreaking worry about death that some of these kids have to deal with.
Yeah, and it's really interesting when you look at it through the lens of child development, you can kind of see how these stressors impact kids differently at different ages.
Makes sense, yeah.
So, your very youngest kids, infants, toddlers, preschoolers, separation is huge for them.
Right.
I mean, you see it all the time. Those little ones, they just get so distressed when they're separated from their parents or caregivers. But as kids get a little bit older, 5 to 8 years old, separation is still a factor, but their anxieties often start to shift more towards those procedures and that loss of control that we were just talking about.
Yeah.
And then older kids, preteens, teenagers, they may put on a brave face, but they start grappling with some of those bigger existential questions, like, what does this illness mean for me? What does it mean for my life?
Right, right.
And they might even start thinking about their own mortality.
And the sources point out that the way that stress manifests can be different depending on the age of the child.
Makes sense.
So younger kids might be more likely to have emotional outbursts, like tantrums or crying fits,
Sure.
whereas older kids might internalize those feelings.
Right. So they might look like they're coping, but they're holding it all in.
Exactly, exactly. And it makes you wonder then, what actually helps kids through these experiences?
Yeah, what can we do to help them?
What can we do? Well, our material highlights a few key things.
Okay.
One, being prepared for what's to come. So explaining things ahead of time in an age-appropriate way.
That makes a lot of sense.
Frequent visits from parents and loved ones.
Yeah.
So important, that connection.
Yeah.
And then, of course, providing opportunities for creative activities like art and play.
That's where medical art therapy comes in.
Exactly. So let's talk about that. Why is art such a good tool in this situation?
Well, I think medical art therapy really draws on that natural way that kids use art anyway.
Right.
We all know kids are natural artists. They're drawing, they're building, they're creating. Before they have a big vocabulary, that's how they express themselves, how they work through conflicts, how they kind of restore emotional balance.
Right. And I love how the sources emphasize that it's not just about the end product. It's not just about the pretty picture that gets created.
Exactly. It's the process.
It's the process, right?
Yeah.
It's about that creative journey. And that journey helps kids develop problem-solving skills, flexibility to improvise,
right.
and to express themselves spontaneously. It's like that creative urge is just innate. It's part of who we are.
Yeah, definitely. And I think for kids, making art isn't just about having fun. It's about making sense of the world around them, making sense of their own experiences.
So how does this actually work in a medical setting? Our sources outline a few key ways that medical art therapy can be beneficial.
Okay, I'm interested to hear this.
Number one, assessment. So using art can actually help us understand what the child is going through, give healthcare providers these insights that they might not otherwise get.
That makes a lot of sense.
It can also help address body image issues,
Oh, of course.
because when a child's body is changed by illness, that can really affect their sense of self.
Yeah, for sure.
Then, art can be a powerful tool for enhancing the mind-body connection, encouraging resilience in the face of these challenges.
Right?
And it even works really well alongside medical play, which is another important way that children process their medical experiences.
I love that. It's like a multisensory approach.
Exactly. And our sources point out that art-based assessments can be really helpful during those critical times, like when a child is admitted to the hospital.
Oh, yeah, that initial period of adjustment, that's got to be tough.
Super tough. Yeah. So whether it's planned admission or an emergency, using art can help the child cope with that initial shock, build trust with the healthcare team,
Right.
and just kind of get a handle on what they're struggling with at that moment.
Yeah, and speaking of getting through those tough times, our sources talk a lot about resilience.
Right. Resilience.
Yeah.
It comes up again and again.
Yeah. And it seems like some of it is tied to those early experiences.
Right. The environment you grew up in.
Yeah, and the support you have. But the good news is it's not fixed. Resilience can grow and change over time.
And what are some of those factors that help kids build resilience?
Well, strong social connections, feeling like you have some control over your own life, what they call an inner locus of control, and just having good psychological resources to draw on when times get tough.
Right. And so, fascinatingly, our sources suggest that using art therapeutically can really help kids tap into and even build those resources.
I'm not surprised. Like we said, it's such a natural way for kids to express themselves.
Exactly. And they specifically talk about creative imagery as a way to help kids feel more in control, even when they're dealing with really difficult things.
Yeah, that makes sense. Like you can give shape to those feelings and anxieties. You're not just trapped by them.
Exactly. Now, another really interesting point our sources bring up is the idea of body image. You know, how illness, pain, if there are any kind of visible changes to the body, procedures, surgery, these can all be really threatening to a child's developing body image.
Oh, absolutely. I mean, their bodies are changing so much anyway at that age. It's a time when they're figuring out who they are, how they fit in. And then when you layer on these medical experiences, it can really shake their sense of self.
Right, and art provides this safe, non-threatening way for them to explore those feelings about their body, to understand and communicate what they're experiencing physically.
It's like giving them a voice when they might not have the words.
And a really important aspect of this whole thing is the role of family.
Oh, yeah. Families are essential.
Essential, right. They're the main support system, the advocates, the ones helping these kids adapt and cope.
Absolutely.
And when families get involved in art therapy, it can be really revealing.
Yeah, how so?
Well, you can see how different family members are processing the child's illness, the kind of support they're able to give, and even anxieties that might be bubbling under the surface, like maybe worries that siblings have, or even the parents' own anxieties.
That's so important. I mean, everyone in the family is affected by this.
Absolutely. And sometimes, the child who is sick might not be well enough to participate in art therapy themselves.
Right. So the focus shifts to the family.
And it becomes all about providing that support and outlet for the family members. And the material really stresses how important it is to not forget about siblings.
Oh, yeah, that's a good point. They can sometimes feel a little bit invisible when all the attention is on their sick brother or sister.
Exactly. And family art therapy can help open up those lines of communication, make sure everyone's feelings are validated, strengthen those family bonds.
I love that. So let's talk about some specific techniques that are used in medical art therapy. Our sources talk about mandala drawing as a great tool for relaxation and stress reduction.
Mandala drawing. Yeah, they highlight how it can be really helpful, especially for kids 5 and older.
And it sounds so simple, but it can be really effective.
Right. So what's involved? The goal is to help the child feel calmer, right?
Yeah.
You have some simple materials. You have oil pastels and paper with a pre-drawn circle on it.
Okay.
And then the child just draws whatever they want inside that
And
circle.
very open-ended.
Yeah, they can express themselves freely. And then they give their mandala a title and talk about it a little bit.
And the interesting thing is the sources talk about this study where they had kids create mandalas and they actually measured their physiological responses.
Really?
Yeah, and they found that the kids who did the mandala drawing had a statistically significant decrease in their heart rate.
Wow.
So actual evidence that this simple activity can promote relaxation.
And it didn't matter what they drew.
That's the really cool part. It wasn't about the content of the art. It was about the process of creating within that circular boundary.
Interesting.
And they even had a control group of kids who did puzzles.
Okay.
And their heart rates didn't really change.
Wow. So that really points to the power of the mandala itself.
It does. It's like there's something about that shape, that container, that promotes a sense of calm.
It makes you think about Jung's theories about the mandala, right?
Yeah, he talked about how they represent wholeness and unity,
Mm.
and how creating them can be a way to connect with our unconscious.
And this study seems to lend some scientific support to that idea.
It does. It suggests that mandala drawing could be a really valuable tool for any child who's feeling anxious or stressed.
Yeah, not just kids in the hospital.
Yeah.
Any child.
Exactly. So, moving on, our sources also talk about art therapy for children with eating disorders.
Right, a really important topic. And they mention that historically there hasn't been as much research in this specific area,
Yeah,
but it's starting to grow.
that's good to hear.
Yeah, and the material points out that eating disorders are less common in boys and younger children.
Right.
They tend to be more prevalent among adolescent girls and women.
But that doesn't mean it doesn't happen in younger kids.
No, not at all. And the sources point out that the impact on growth in younger children can be really serious.
Because their bodies are still developing.
Exactly. So what are some of those signs of eating disorders that parents and caregivers should be aware of, especially in younger children?
Well, the sources mention things like a determined refusal to eat, not gaining weight as expected, actual weight loss, being overly concerned with their weight and body shape.
Right, right.
And they also talk about other behaviors that can sometimes go along with eating disorders, like self-induced vomiting, laxative abuse, excessive exercise, and having a really distorted view of their own body.
Right. And the material mentions that eating disorders seem to be increasing in frequency
Right.
and that diagnosing them, especially in younger children, can be tricky.
Yeah, that makes sense. It's a complex issue.
It is. And then, of course, there are the psychosocial factors that can contribute to eating disorders.
Right, like what's going on in their lives and their families and the wider culture.
Exactly. And the sources mention things like early conflicts, difficulty identifying feelings, a wish to avoid growing up, and sometimes family dynamics that don't really encourage creative expression.
And I imagine cultural messages about thinness and appearance play a big role too.
Absolutely. And our sources even point out that medical interventions themselves can be traumatic for children with eating disorders.
Oh, like feeding tubes.
Like feeding tubes, exactly.
Yeah.
So it's a really complex issue that needs to be approached sensitively and from a variety of angles.
Yeah, it sounds like a multidisciplinary approach is really important.
Absolutely. And the sources talk about how art therapists are often part of that team on psychiatric units that specialize in treating children with eating disorders.
And I imagine for a lot of families, this is a really new step.
Right. They may have been to multiple doctors trying different things, and the idea of inpatient psychiatric care is a big decision.
Yeah, it can be a lot to process.
It can. Now, to really illustrate how art therapy works with this population,
Right.
our sources give us a couple of really powerful case studies.
Oh, okay, yeah, I'd love to hear about those.
So the first one focuses on a 16-year-old boy named John,
Okay.
and the therapist used what's called directive art therapy with John, meaning she gave him specific instructions for what to draw.
Interesting.
Yeah, it's a specific approach that can be really helpful in some cases.
So what was John's story?
Well, when he was hospitalized, he was pretty sick. He had a weakened immune system, some cognitive impairment, and he was really struggling. He was preoccupied with his weight. He was severely restricting his food intake, exercising excessively. He had become withdrawn socially, and he was really irritable, which had caused a lot of tension with his family.
Yeah, it sounds like he was in a really dark place.
He was.
Hmm.
And as John started to trust his art therapist, he began to open up about his fears, about feeling controlled by his illness.
Makes sense.
And he even talked about his ambivalence about getting better.
Oh, interesting.
Yeah, it's a common feeling for people with eating disorders, that fear of letting go of the illness.
Right, like it's become a part of who they are.
Exactly. And at one point, the therapist suggested that he draw what his illness looked like to him.
Oh, powerful.
Yeah, and then for his next drawing, she asked him to draw himself in relation to the illness.
Wow, so a way to visualize that relationship.
Exactly. And what John created in his art was really telling. He said, quote, "Anorexia, it's a prison. It keeps me from the relationships I want to have. This is my mother. We're reaching out to each other, but the anorexia keeps us apart. It feels like the anorexia is much bigger than me. It's in my head. It controls my thoughts." End quote.
Wow, that's so powerful. It really gives you a sense of how trapped you felt.
He did. And the therapist noticed that both figures in the drawing, John and his mother, had open mouths and kind of angry expressions,
Oh, even though he said they loved each other?
even though he said they loved each other.
Interesting.
And this made the therapist wonder if there was some underlying anger towards his mother that John wasn't quite ready to acknowledge.
Yeah, makes sense.
Yeah, especially given that his mother had become really intensely focused on managing his care since he became ill.
Oh, right.
Yeah. But the therapist didn't push it. She respected John's boundaries.
Good.
But as their work continued, John had this amazing realization. He said, quote, "At least now I know what the enemy looks like," end quote.
Wow, that's a big step
It is.
to be able to name it, to see it as separate from himself.
Exactly.
So what about the second case study?
So the second one focuses on Miranda, an adolescent girl with anorexia. And her art also evolved quite a bit over the course of her treatment.
In what way?
Well, at first she was really afraid of eating and swallowing.
Oh, that must have been terrifying.
It was. And she actually used the image of a bird to represent those fears.
Okay, a bird.
Yeah. Interesting choice, right?
It is. I wonder what the significance of that was for her.
Well, that's something that they would explore in therapy. But as Miranda continued with the art therapy, something shifted.
Okay.
She started using paint for the first time.
Oh, wow.
And she created this picture with a sun, a cloud, a tree, a caterpillar, a kite, and a bird.
So the bird was still there, but there were all these other elements too.
Exactly. And it seemed to represent a shift in her thinking, a broadening of her perspective.
Yeah, like she was starting to see possibilities beyond her fear.
Exactly. And at one point, she actually spilled some brown paint.
Oh, no.
But instead of getting upset, she turned that still into a kite.
Wow, that's amazing.
Right. It was like this spontaneous act of creativity of turning a mistake into something beautiful.
Yeah, like she was learning to embrace those unexpected turns.
Exactly. And when she described the picture, she said, quote, "The caterpillar escapes the bird. The caterpillar becomes a gold butterfly," end quote.
That's so symbolic, the caterpillar transforming into a butterfly.
It is. It's like this metaphor for her own potential for growth and change.
And the fact that she kept coming back to that bird image over time
Right.
suggests that she was really working through those deep-seated fears.
And the therapist noted that Miranda's art seemed to reflect her growing capacity to tolerate a range of emotions,
Okay.
to think about different solutions to problems.
That's huge.
It is. And the interesting thing is, those changes in her artwork happened before she was ready to talk about them directly or make changes in her behavior.
Right, so the art was a way to process those things on a deeper level first.
Exactly. So, to sum up, how does art therapy help patients with eating disorders? Our sources highlight a few key things.
Okay, let's hear it.
Number one, it gives them a way to express those really tough emotions, the fears, the anxieties.
Right.
It helps them develop self-esteem
Okay.
by allowing them to kind of put those negative self-perceptions outside of themselves and slowly start to build a more positive self-image.
Yeah,
It's a really valuable tool for exploring body image issues,
of course.
which are so central to eating disorders.
Right.
And it can help patients start to objectify the illness
Mm-hmm.
so they can see it as something separate from who they are.
I see.
And then importantly, it provides this connection to the outside world and this visual record of their progress.
That's so important, especially when they're in that hospital environment.
Exactly. And as we saw with John, specific art activities like drawing the illness, drawing yourself in relation to the illness, and drawing your supports can be really powerful.
Yeah, those are great interventions.
And the sources make this really key point that often those changes appear in the art before they show up in behavior.
Right, like we saw with Miranda.
Exactly.
Mhm.
Okay, let's shift gears now to art therapy with children who have cancer,
Okay.
another really important and challenging area.
Absolutely.
And our sources make this really powerful comparison. They say that for a child, starting long-term cancer treatment can be like entering an alien culture.
Wow, that's a really striking image.
It is, because suddenly you have these unfamiliar sights and sounds and smells, words that you don't understand, procedures that can be really scary and painful, and it just completely disrupts a child's sense of trust and security.
Yeah, it makes sense. Their whole world is turned upside down.
It is.
Mm-hmm.
And in this context, art becomes this incredibly important source of comfort.
Okay.
It gives children a way to express themselves freely, to reduce stress, to gain some sense of control in a situation where they often feel powerless.
Right, that feeling of control is so important.
It is. Now, while childhood cancers are obviously incredibly serious, the sources also emphasize that they are often treatable.
That's good to hear.
It is. And many children will recover. However, the treatment can be really long and intense.
Yeah.
And it requires a lot of adaptation for the child and the family. They're in and out of hospitals and clinics. There are things that need to be managed at home.
So the therapist really needs to be flexible,
Absolutely.
meeting the child where they are.
Meeting the child where they are. And our material goes into some of those common physical side effects that children with cancer have to deal with as a result of the treatment.
Okay, like what?
So things like hair loss, changes in weight, changes in appetite and taste, constant fatigue, anemia, sleep disturbances, increased vulnerability to infections,
Oh, God.
painful mouth and throat sores, the effects of surgery. It's a lot.
Yeah, it's a huge burden.
Huge burden.
On top of everything else they're going through emotionally.
Exactly. And the sources also talk about the psychosocial experience of childhood cancer.
Yeah.
And they say it's not just about death. There are these layers of loss that happen throughout the illness experience.
Right, so it's a process.
It's a process, and children and families have to come to terms with this idea that bad things can happen to them, which the sources refer to as the Damocles syndrome.
The Damocles syndrome. Interesting.
And just like with other challenges, a child's understanding of death changes as they develop.
Makes sense.
So younger children, they might not see it as permanent.
Okay.
They might focus more on that fear of being separated from their loved ones.
Yeah, that makes sense for a young child.
Then school-age children, they're starting to understand cause and effect, but they might think of death as a punishment,
Okay.
and they might have these fears of physical harm. Older children, they usually have a more sophisticated understanding of death,
Okay.
but teenagers, even though they understand it intellectually, they often struggle with feelings of invincibility.
Oh, right.
It's hard to accept that something that final could happen to you when you're young.
Absolutely. And it's fascinating how facing that possibility of death at such a young age can have different impacts on different kids.
It can.
Hmm.
For some, it can lead to this kind of accelerated emotional maturity.
Oh, wow.
But for others, it can manifest later as difficulties, maybe school refusal or engaging in risky behaviors.
That makes sense.
So given all these challenges, our sources outline some really specific goals for using art therapy with medical patients.
Okay, what are they trying to achieve?
So number one, emotional expression.
Makes sense.
Giving kids that safe outlet to just let those feelings out.
Yeah.
Then symbolic representation of physical states.
Okay.
So encouraging kids to use symbols to show how their body feels, like what their pain feels like.
I like that.
And then helping them express their expectations of treatment, coping through diversion. So sometimes art can just be a distraction from the difficult stuff.
Right, like a positive escape.
Exactly. Developing personal imagery. So images that are meaningful to the child that they can draw on for strength and comfort.
Yeah.
Encouraging interaction and support.
Okay.
So using art as a way to connect with others,
Right.
and then ultimately building a sense of competence and control.
Which is so important.
So important in these situations.
Absolutely.
And to illustrate these goals in action, our sources give us some really moving case studies. The first one is Julie, a 5-year-old girl who is starting cancer treatment.
Okay, Julie.
And initially, her artwork focused on being separated from her brother, which was her biggest fear at that point.
Oh, heartbreaking.
It was. She even created these masks to represent herself and her brother.
Wow.
But then as Julie learned more about her condition from the doctors and nurses, the social worker, and the art therapist, her artwork started to show this new understanding.
Okay.
And she even made her own puppets to show how leukemia and the treatment worked. Kind of like the medical play you were talking about.
Oh, that's cool. So she was processing what she was learning through her art.
Exactly.
Yeah.
And get this, she created her own Kingdom of Cancer game. Yeah. So she used words, pictures, and play to act out her experience.
Wow, that's amazing.
It is. So she had this game board and dice, and she would dictate the rules, which would take players through different stages of her treatment, like getting a Broviac catheter, getting bone marrow aspirations, taking the yucky medicine. And it all led up to this 7th birthday party, which symbolized the end of her treatment.
Oh, that's beautiful. So the game was a way for her to make sense of her journey, to find a sense of control.
Exactly. And she would invite other people to play with her, which allowed her to share her experience and work through some of those tough emotions.
That's so powerful.
It is. Her art became this externalizing force, allowing her to express her anxieties and even any potential post-traumatic stress she might have been experiencing.
That's incredible. What about the second case study?
So the second one focuses on Mike. He was diagnosed with leukemia at age 10.
Okay.
And he finished treatment when he was 13. So he's a little bit older.
Yeah.
However, even though his cancer was in remission, he continued to have some difficulties. He had trouble with peer relationships. He had problems concentrating. He wasn't going to school regularly. And he even started having these fainting spells and seizure-like episodes.
Wow, that's a lot to deal with even after the cancer is gone.
It is. And when doctors couldn't find any neurological reason for his symptoms, they started to think about whether there might be psychological factors involved.
So art therapy was suggested.
Art therapy was suggested as a way to explore those potential psychological factors. And interestingly, Mike had a history of some depressive symptoms even before his cancer diagnosis.
Oh, okay.
Yeah. So his early artwork during his initial hospitalization was really moving. When his hair started falling out from chemotherapy, he drew this little wolf hiding in a cave.
Oh, wow.
And he actually glued his own hair onto the wolf to give it fur.
That's both heartbreaking and kind of amazing.
It is, right. It's like this really tangible way of processing that loss, of connecting with this strong animal figure.
Yeah, finding strength in that image.
Exactly. And it also showed that he had a sense of humor about it.
Yeah, which is so important.
But Mike's artwork also included some darker themes.
Okay, like what?
Car crashes, wars, frightening faces.
Oh, wow.
And one drawing in particular that he made right before a bone marrow aspiration was really disturbing. It showed this figure that looked like a person with a huge hole in its chest, surrounded by sharp lines and what looked like blood.
Oh my gosh.
And even though Mike didn't say outright that it was him, the feeling of the drawing was one of profound trauma and fear.
It makes sense. Those procedures can be really scary.
They can be. And even after Mike finished his cancer treatment, those seizure-like symptoms continued. So the goal of art therapy in this later phase was to really help him process those experiences and regain a sense of well-being.
Okay.
And the therapist was thinking that maybe post-traumatic stress could be contributing to his physical symptoms.
Yeah, that's possible.
Yeah. And one really interesting activity that they did was a bridge drawing.
A bridge drawing.
Yeah, so the therapist asked Mike to draw a bridge representing the gap between his cancer treatment, his life now, and what he hoped for in the future.
Okay, and what did he draw?
It's really interesting. He drew a past representing his initial treatment that was full of holes and broken planks.
So very unstable.
Very unstable. The middle part, which symbolized the present, was solid,
Okay.
but the bridge just stopped.
It just stopped.
There was no future.
Wow.
Just this big empty space on the page.
That's really powerful.
And while he didn't explain it directly, the absence of a future suggested that maybe, at some level, he didn't really expect to have one.
That's really sad.
It is. It shows the lasting impact that these experiences can have on a child's sense of hope and possibility.
Yeah, it really highlights the importance of addressing those underlying psychological issues.
Absolutely. Now, our sources also briefly describe a family art session with the siblings of a child who was in the ICU.
Okay.
This child had a really severe reaction to chemotherapy and was on life support.
Oh, wow.
And the younger brothers, ages 6 and 8, were really scared about visiting their sister in the ICU.
Understandably.
So the therapist had them use clay to make figures of their sister and a hospital bed.
Oh, that's a great idea.
It was. And this really hands-on activity allowed the younger brother, who was especially anxious, to express his fears about how his sister might look.
Okay.
And then the therapist and their father were able to give them a more realistic picture of what to expect, which seemed to ease some of his anxiety.
That's great. So